My name is Carol Lawson, and I was a social worker in healthcare for many years. I joined HSAA in 1985 and became a board member in 1998. I was also a VP of the Vice President of Services and a Vice President of Human Resources during the 10 years I was on the board. The years under Ralph Klein and that conservative government were incredibly difficult. The goal was definitely to starve the public healthcare system. And when you starve the public healthcare system, then people begin to think about private healthcare. So during that time, they brought in Bill 11. Bill 11 was the Health Protection Act. What it did was it gave private operators the right to provide private surgery funded with public dollars. So there were huge rallies about Bill 11, and I remember being at the ledge and pounding my pot, with my wooden spoon and doing this for days. And then because the conservative government had a majority government, they passed the bill into law one night about 9 o'clock at night, and off we went home. Well, I think probably one of the biggest projects was joining the House of Labor. But also I think one of our projects was to develop locals that were meaningful to the members, so that new members and members that had been there a while would actually start getting connected to the union and to realize why the union was important to them. And it wasn't just about getting your 10-year PIN, and it wasn't just about getting your 15-year PIN. It was about really why it's important to, become a member and to support HSAA and to stay connected with the issues. And for the group reps to take back all that information and then have meetings at, in their locals. And yeah, all of that is really, really important. I used to do that everywhere I went. I'd do it in the hallway, I'd do it, that was a fun part of it, was trying to get members to connect. Well, HSAA is a union of public service employees, so it's really important for the union to keep that vision in mind. It's really easy to get caught up in the day-to-day little things that are happening, but the big picture issues of providing public health care to the people of Alberta, providing public education to the people of Alberta is really, really important. So it's really important for them to remember why the union is so important in terms of taking that fight to people. It's about contracts. Of course it's about contracts, but it's really about bigger things. And the goal of this government is to privatize. There is scads of money to be made in privatizing healthcare. Oh my gosh, there are many people who would get rich. But that wouldn't be good for the people of Alberta. It wouldn't be good for our patients. It wouldn't be good for health, for the Albertans. It would be terrible.